The number of new COVID-19 cases in South Korea rose again, mainly due to cluster infections. As part of efforts to effectively manage medical resources, the government eased its criteria for people to be released from quarantine. Mok-yeon explains further.
South Korea saw 51 more cases of COVID-19 on Wednesday, up from 46 cases the day before and just 17 on Monday, which was the lowest in almost a month. That brings the total number of infections to 12,535. Of the new ones, 20 were imported from overseas and the rest were part of cluster infections, mostly in the capital area. To make sure there are enough beds in case of a second wave, the government has revised the standards, so they'll be used only for people who are contagious or have serious symptoms.
Under no circumstances should anyone go without treatment again because of a lack of sick beds. To prepare for a second wave, we must be able to effectively make use of our medical resources to protect the lives of the people.
Under the new measures, beginning Thursday, COVID-19 patients could be released from quarantine if they show no symptoms for 10 days after testing positive. Patients with symptoms 10 days after testing positive can be let go if they have no fever for 72 hours without medication. Now, quarantine decisions will be based more on symptoms rather than polymerase chain reaction testing, which often yields a positive result, even when the patient is not contagious. The government has also strengthened quarantine controls on Russian ships arriving in the southern port city of Busan from Wednesday. There, at least 17 crew members on ships from Russia have tested positive, exposing a loophole in quarantine procedures at ports. Passengers and crew arriving in Busan will now be tested on board their ships instead of being admitted with only an electronic health questionnaire. Mok-yeon, Arirang News.